I'm Anthony Cave, a board-certified anesthesiologist and integrative medicine specialist. I'm going to share 3 secrets Big Pharma uses to make anxiety meds so hard to ever get off of. Then, I'm going to share my secrets for how to beat them at their own game. Number 1 is that fast highs are addictive and can dangerously change your expectations. Any addiction fundamentally changes your brain's chemistry and anatomy, whether it be drugs or sex or gambling or whatever. Whenever your brain experiences something fast, it overwhelms your brain's mechanisms to protect against addiction. It's like walking into a dark room, flipping the light switch, and having all those blinding lights blind you for a couple seconds while your brain is trying to catch up with what happened. When that happens with addictive substances or experiences, your brain can't keep up with the dopamine surge that's going on, and you're at risk of becoming addicted. Let me give you a couple of examples. Think of the sugar high. There's a reason why the sugary snack industry is crushing it right now. That blood glucose spike stimulates all the pleasure centers in your brain quickly at once, and your brain can't keep up to help prevent an addiction from forming. Next, think of eating versus smoking marijuana. When you smoke marijuana, all those cannabinoids go into your lungs and quickly hit your brain to give you that sensation. That's totally different than the effect of eating marijuana on your brain. The same goes for snorting certain drugs. Those highly refined powdered drugs hit your nose epithelium, they can get absorbed in your nasopharynx and quickly overwhelm the pleasure centers of your brain and put you at risk of addiction to those substances. Another example is for the heart. Maybe you know somebody who takes nitroglycerin under their tongue. That helps the nitroglycerin quickly hit the heart, kind of like a heart high. It's also what some people do with alcohol when they leave it under their tongue to absorb quickly to hit their brain faster. And because I'm in an operating room, I have to mention that anesthesia works the same way. Whether you inhale it through a mask or get an injection in your IV, that's hitting your brain really quickly, hence why a lot of our anesthesia medications can be drugs of abuse. And this is exactly what powerful anxiety medications in the benzodiazepine class, like Xanax, Valium, and Ativan, all do. They quickly rush to your brain and overwhelm your brain's protective abilities to help protect against addiction. Really good business for pharmaceutical industries, not so good for patients. On top of that, this sets up dangerous expectations for patients because it's really hard to find isolated alternatives in the natural world to these powerful medications that quickly give your brain a high or a rush of anti-anxiety. But don't worry, I'll share tricks to get around that in a minute. Number 2 is the medicalization of normal human experiences. Anxiety is very real, as is depression. It affects millions of patients every single year in this country alone. However, there's also controversy about medicalizing normal human experiences and normal human behaviors. This is because humans like to put labels on things. It's really easy just to label someone as having a depressive disorder or as having an anxiety disorder. It doesn't mean anxiety and depression aren't real, because they absolutely are, but it does question how we're going to treat experiences of depression and experiences of anxiety, many of which can be normal in many circumstances in life. Unfortunately, pharmaceutical industries can leverage this tendency for us to label and medicalize normal experiences and behaviors to impact how us doctors treat our patients, because it's so much easier to prescribe a pill for something when the patient has that label associated. These pills simply don't help us address the underlying root causes of anxiety, making it really hard to ever get off of them. And number 3, anxiety medications are simply really effective, but they come at a cost. There's a reason why benzodiazepines are called tranquilizers or tranks. It's how they can take down giant animals sometimes when you inject them with a dart, because they attach to GABA receptors in your central nervous system. And these receptors are super conserved across mammalian species, which means that when you attack them, they're really powerful and they have powerful side effects, which is why drowsiness or straight up sedation or being knocked out is one of the major side effects of benzodiazepines. They're not only dangerous on their own, but they're even more dangerous when mixed with other sedative medications or even natural substances, things like opioids, like fentanyl, or even natural anxiety relievers like valerian root. This has compounded the opioid epidemic to make mixing these things even more dangerous for patients. Now that you know what makes these anxiety medications so powerful, you can better find alternatives to help you lower your dose requirements or get off of them altogether, and more importantly, set realistic expectations and avoid their side effects. Full disclaimer, there are very few things in the natural world that can be as powerful on their own as benzodiazepines, especially the strong ones like midazolam or Versed that I'm holding right now. However, the power of natural therapies is that some of them are not only powerful on their own, but when combined with others, can be even more synergistically powerful without the side effects or the addictive properties of benzodiazepines and other medications. So for example, we can take advantage of inhaling medications like essential oils through aromatherapy to quickly get medications to reach our brain so we can feel our anxiety relief faster, but because they're less potent than benzodiazepines, aromatherapy and essential oils don't have the same addictive properties. Essential oils with good evidence for reducing anxiety include sweet marjoram, lavender, mandarin, and ginger. We compare this with neurologic techniques and mind-body techniques to quickly, through our nerves, calm our bodies down. I've done this before with breathing and with biofeedback here connected to monitors, where within seconds, I've calmed my entire body down and strengthen my parasympathetic tone. Guided imagery also falls in this category and can also be as effective as low-dose oxycodone for this reason. Music therapy can also have quick effects because it goes through your nerves from your ears to your brain. And then there are oral supplements. You know these are slower to act because you have to eat them, but they can pair with essential oils and neurologic techniques for greater effect. These are naturals like valerian root, L-theanine, kava, inositol, and lemon balm. And then we have slower acting and foundational techniques to address anxiety naturally. The first is nutrition, because if your brain doesn't have the right nutrition, it's going to be more susceptible to anxiety attacks. Things like B vitamins, essential fatty acids, vitamin D, zinc, and iron are all important to have an adequate supply so your brain can function normally. Same for sleep, because insomnia totally fuels anxiety. And then there are other slower acting techniques that can help you find the root cause of anxiety, things that benzodiazepines can never do. These are things like clinical hypnosis, mindfulness-based stress reduction, and spiritual and meditative techniques. And then there are physical interventions, things like acupuncture, yoga, tai chi, or even massage that have a slow onset but have a sustained response and can be synergistically effective when combined with the other techniques we talked about. Hey, quick question for you. Have you heard of any of these techniques before? If you have, which one do you want to try integrating into your life so you can reduce your medication dependence? Let me know below in a comment. So the question isn't whether these other natural techniques work, because they all do and there's plenty of evidence for them. The real question is, which of these techniques work for you, that you enjoy doing, that you can combine together to begin to tap into your inner healing potential and hopefully reduce and eliminate your needs for other medications.